Today I want to talk to you about the pearls of renal failure. The kidneys are located in the retroperitoneum. Each kidney is covered by a capsule. Sitting directly under the capsule is the renal cortex. The cortex is bordered by the medulla. The medulla is shaped like a pyramid and is called the renal pyramid. Between each renal pyramid, there is a renal column. At the medial point of each pyramid is the renal papilla. The renal papilla opens into the minor calyx. More than 2 minor calyces open into the major calyx. The major calyces open into and form the renal pelvis. The renal pelvis opens into the ureter. A renal lobe is made up of the corresponding cortex and the renal pyramid. The nephron is the functional unit of the kidney. It is comprised of a tuft of capillaries called the glomeruli. The glomeruli sits in a cup-like capsule known as Bowman's capsule. Bowman's capsule opens into the proximal convoluted tubule. The proximal convoluted tubule continues as the descending limb of the loop of Henle. The descending limb becomes the loop of Henle. The loop of Henle continues as the ascending limb of the loop of Henle. The ascending limb of the loop of Henle continues as the distal convoluted tubule. The distal convoluted tubule continues as the collecting duct. The collecting ducts open into the renal papilla. Blood flows through the kidneys start with the renal arteries. The renal arteries branch into the arcuate arteries. The arcuate arteries branch into the interlobular arteries, and finally into the afferent arterioles. The afferent arterioles become a tuft of capillaries known as the glomeruli. The unique thing about these capillaries is that they continue as the efferent arterioles. The efferent arterioles continue as the peritubular capillaries, which run in close proximity to the nephrons. These peritubular capillaries eventually converge into the arcuate veins. Let's talk about the types of renal failure. There are 3 types of renal failure: pre-renal failure, intrarenal failure, and post-renal failure. Pre-renal failure may be caused by anything that decreases blood flow through the kidneys, such as hypertension, congestive heart failure, excessive vomiting, or hemorrhage. Intrarenal failure. Intrinsic acute renal failure is due to malfunction of the nephron and the blood vessels. It could be, number 1, vascular disease from thromboemboli. Number 2, glomerular disease, as in glomerular nephritis, and a drop in the GFR, or it could be tubular intestinal disease, which is most commonly due to acute tubular necrosis. The third type of renal failure is post-renal acute renal failure. This is due to events that occur after the formation of urine. This includes obstruction due to, number 1, ureteral obstruction from renal stones, number 2, nephrogenic bladder, or number 3, urethral obstruction secondary to BPH and or malignancy. Now let's talk about the functions of the kidney. There are 4 functions that you should be aware of. The first one. First, there is filtration. This occurs in Bowman's capsule. Blood is filtered out from the glomerulus into Bowman's capsule. Second, there is absorption. As the filtrate leaves Bowman's capsule and travels down the nephron, substances are reabsorbed back into the peritubular capillaries. The third function is secretion. This is where substances in the peritubular capillaries leave the capillaries and travel across the tubular cells into the lumen of the nephron. And the fourth function is excretion. This is the excretion of urine. Once the filtrate reaches the collecting duct, it becomes urine. Let's talk about renal clearance. Renal clearance is the rate at which creatinine and BUN are removed from blood at the level of the glomerulus into Bowman's capsule. It is the rate at which filtration occurs in Bowman's capsule. The normal range is 90 to 125 ml per minute per body surface area. The glomerular filtration rate is determined by age, body size, and gender. In terms of age, the glomerular filtration rate decreases with age. In terms of body size, the glomerular filtration rate decreases with obesity. And in terms of gender, the glomerular filtration rate is higher in males than females. High serum creatinine is an indication that the glomerular filtration rate is low. Both creatinine and the glomerular filtration rate are two reliable indicators of renal function. Even before the glomerular filtration rate drops and serum creatinine increases, diabetic patients can have small trace of albumin in the urine. This is called microalbuminuria. Here are some additional information you should know. Elevated BUN may be due to starvation, dehydration, or hypovolemia. The ratio of BUN and creatinine is obtained by taking the BUN and dividing it by the creatinine level. In pre-renal failure, the ratio is greater than 20 to 1. In intrarenal failure, the BUN creatinine ratio would be less than 15 to 1. In post-renal failure, the BUN creatinine ratio may range from 10 to 20 to 1. The specific gravity of urine is a measurement of urine concentration. The urine pH ranges from 4.5 to 8. Urine protein suggests renal disease. Osmolality is a measurement of urine or serum concentration. Myoglobin is toxic to the kidney and can indicate early renal failure. Myoglobin is an iron and oxygen binding protein, and it is found in the cardiac and skeletal muscle tissue. Myoglobin is only found in the bloodstream after muscle injury and may result in rhabdomyolysis and renal failure. Which is the best test to determine UTI? Both leukocyte esterase and nitrite have been used. However, nitrite can stand alone. Which electrolyte is elevated in end-stage renal disease? Potassium is elevated in end-stage renal disease. How is vitamin D affected in renal failure? Inactive 25-hydroxyvitamin D decreases. Therefore, conversion to 1,2,5-dihydroxyvitamin D also decreases. As a result, calcium decreases and phosphate increases. How are hemoglobin and hematocrit affected in chronic renal failure? In acute renal failure, hemoglobin and hematocrit are unaffected. But in chronic renal failure, both hematocrit and hemoglobin are low because of the lack of erythropoietin. How is calcium affected in renal failure? Calcium is usually low in chronic renal failure because of the decrease in vitamin D. Vitamin D is needed to facilitate the absorption of calcium from the gut. This can also result in bone problems, namely fractures. Before I close, I'd like to mention one other aspect of renal function, and that is the fractional excretion of sodium. The fractional excretion of sodium measures the percent of filtered sodium that is excreted in the urine. It is used to help differentiate pre-renal disease from acute tubular necrosis as the cause of acute kidney injury. In general, fractional excretion of sodium below 1% suggests pre-renal disease, while a value above 2% usually indicates acute tubular necrosis. Well, thanks for watching. Please don't forget to like, share, and subscribe. I wish you well. Good night.